There I was, freshman year. Wind in my hair, face red and puffy, muscles fatigued, lungs screaming for air, while the soccer ball floated effortlessly above my head, blocking the sun. Those few moments were the only relief I had from the sun in almost 3 hours. It was so wonderful, I paused. I let the ball pass me and the other team got possession. I wasn't sure what time it was or how long we had left to practice. All I knew was in the moment the sun was gone, I could breathe again, and I needed to find some way to make that last. So the first thing that came to mind was that an injury would get me off the field and in my bed where I could sleep. So I make a list of possible injuries: broken knee, horrible fall, concussion, faint, fake a pass out. So there I fell, breathless and exhausted in the green grass behind the gym. And that was the day that I found out I had bicuspid aortic valve disease. BAV runs in families and is the most common congenital heart defect present at birth. Although this disease comes with many complications that increase the chance of fatality, it can be managed through advanced medical procedures and careful monitoring. This presentation will give you a better understanding of what bicuspid aortic valve disease is, the complications it presents, how doctors diagnose this disease, and the treatment options once severe complications arise. So to begin, let's define what BAV is and why it can be so life-threatening. Bicuspid aortic valve disease involves the aortic valve, which is a one-way valve responsible for regulating the flow of oxygenated blood from the ventricle to the aorta. Normally, this valve has 3 little leaflets or little flaps that open to let blood flow through and close securely to prevent blood from flowing backwards into the heart. Valves affected by BAV, like mine, only have 2 leaflets. This deformity causes many complications. 2 of the most common are aortic regurgitation and aortic stenosis. Aortic regurgitation is what happens when the valve doesn't close securely, allowing some of the blood to flow backwards each time the heart pumps. This can give rise to other complications, such as ventricular widening and a forceful heartbeat. Aortic stenosis is what happens when the valve can't open fully, which leads to complications such as the blocking of blood, the backup of blood into the lungs, and another thing. A study done on BAV patients shows that this disease increases the risk of aortic dissection to 8 times that of the general population, and the risk of aortic aneurysm to 86 times that of the general population. These are the statistics that will define my life living with this disease. So, how did my fake pass out turn to being diagnosed with BAV? Well, I went to the doctor, and there they ran their tests. First, I went to my primary care physician, where they did a routine checkup, including listening to my heart and my lungs. When my doctor listened to my heart, she found that it made a clicking sound when it beat, which was concerning to her because my medical records didn't indicate that I had any kind of heart disease or defect. So she sent me to a cardiologist where they ran more extensive testing, including a cardiac MRI and a chest x-ray, to see if my heart was enlarged or inflamed. These ruled out that my heart was neither. So then they did more extensive testing, including an echocardiography, which is just a heart ultrasound, and an electrocardiography, which measures the electrical impulses sent from your heart. Through these tests, they were able to determine that I did have bicuspid aortic valve disease. Now that we know what bicuspid aortic valve disease is, the complications it presents, and how they diagnose this disease, we can talk about treatment options. So the treatment plans vary depending on the progression of this disease. If the disease is stable and it's constant, then the plan varies from just healthy lifestyle changes to a regimen of medicine to help prevent any further complication, and regular checkups with your doctor to monitor any changes. If the condition is worsening and severe, then the treatment plan is usually heart surgery, which can be performed through robot-assisted, minimally invasive, and open heart techniques. The surgeries usually include heart valve replacement and heart valve repair. It's crazy to think that such a small deformity on a vital organ can lead to such huge complications. I'm lucky then that as this disease is characterized as a silent killer, with things such as aortic dissection and aneurysms being almost virtually undetectable until it's too late, that I found myself in a doctor's office when all I wanted to do was get out of the sun.